Hi, everyone. I was just dancing to the music. I love that intro. Good evening and welcome to the JDRF 2024 Type 1 Nation Summit. My name is Jordan Robinson, your host, and I'd like to thank you all for joining us this evening. Some of you may know I'm a sports journalist and a podcast host specializing in women's basketball and college sports. I was diagnosed with T1D at 23 years old, and I am an overall sporty girly. Played college basketball and discovered my love for journalism while in San Diego. Since I've been attempting to balance the craziness of freelance life with T1D, and I'm doing it. So I know that you can all do it too. And I am an ambassador for JDRF as we continue to have these important conversations like this one. Tonight is the first session of our 4-part virtual series titled Ages and Stages: How Research and Advocacy Are Having a Global Impact on People with T1D. We are excited to share top research advancements, advocacy progress, and how JDRF is making a global impact. You also hear from several T1Ds sharing their stories, tips, and tricks. That's my favorite part. The TypeOneNation Summit program offers education, connection, and inspiration on various important topics to help you and your loved ones live well with T1D. Throughout the year, we'll host virtual sessions like tonight and many in-person summits as well, hosted by JDRF chapters across the country. Please register if you'd like to stay up to date on our virtual series. We'll post a link in the chat. You can also visit the same link to find an in-person Type 1 Nation Summit event near you. So before we get started, I'd like to extend a special thank you to our national industry partners. Their support helps make the Type 1 Nation Summit program possible. So many options are available to you to help you and your loved ones manage and ease the daily burden of T1D. JDRF does not endorse any specific product or brand and would encourage you to visit jdrf.org to learn more about all the options available to you and your family. We also encourage you to speak with your healthcare provider to discuss the options and a treatment plan that would work best for you and your loved one. We also want to take a moment to recognize that we are fortunate to be here today during National Volunteer Week. As implied by its name, National Volunteer Week is observed across the United States and gives us the opportunity to celebrate the spirit of volunteerism. At JDRF, our volunteers are passionate and unwavering in their pursuit of cures. We are honored to partner alongside you to advance life-changing research. On behalf of all of us at JDRF, thank you for driving our shared mission forward. Now, without further ado, you're in for such a treat this evening. Like every time, I say it every time, but you're in for a treat. So if you haven't already done so, please share this link to this session and tell your friends and family to tune in right now. We're about to get started. Also, feel free to comment and ask questions in the chat. It is always popping over there. Make sure to say hey and what's up. We'll try to get to as many as possible. Any questions that you may have, we'll also be posting resources there throughout the discussion. We have so much to cover this evening, so let's jump right in and introduce our very first guest. Madison Carter is a broadcast journalist and investigative reporter. She received international recognition for her extensive reporting following the civil unrest that emerged after George Floyd's murder. The Buffalo News named her News Personality of the Year, and the NAACP recognized her for being a critical voice for people of color and using her platform to push the envelope in the criminal justice system. Madison has lived with T1D for more than 25 years and advocates for greater access to affordable insulin and medical supplies. Her commitment to this cause has led her to take on a new role as a board member of the JDRF North Carolina chapter. Additionally, Madison served as an executive officer for the National Association of Black Journalists, further demonstrating her dedication to making a positive impact in both the diabetes community and the field of journalism. Madison will be sharing T1D news with our community during each session. We are so fortunate to have her share her incredible talent and expertise this year. Ladies and gentlemen, please show a warm welcome to Madison Carter.
Jordan, thank you so much. I am more than thrilled to be here at this virtual TypeOneNation Summit, especially to talk with you all about such an important and timely topic. Today, we're talking about how to beat the heat. Summer's on the way. It's super exciting, but I know a lot of you as type 1 diabetics know that sometimes it can be a little tricky. Don't worry about it though. We've got you. So, first tip, I have 5 of them for you. The first tip is going to be this summer, you want to make sure you're staying hydrated. Hot water, it can quickly dehydrate anybody, but especially with us, things are always a little bit tougher. So you're going to want to avoid those blood sugar spikes by making sure that you're staying up on your water. Throw some electrolytes in there. It'll really help you out, and make sure you're doing that throughout the day. And then tip number 2, test your blood sugar levels even more frequently than you typically do. It's summer, we all have our CGMs, but if you don't, make sure that you're trying to set an alarm or have equal intervals where you can make sure to go get that finger prick, test your blood sugar levels, because a lot of times these hot temperatures, they can cause more fluctuation than we see all the time. So it's a good idea to stay on top of it. If you have a monitor, make sure you're checking more frequently so you can take more corrections if needed. And then tip number 3, this is always the hardest one, right? You're going to want to make sure that you're protecting your gear. Try to keep your pump covered if you can. And of course, keeping that insulin cool, that's tough, but we all know how to do it. We're finding those pockets of shade, keeping things in our pockets, throwing it in the car, maybe in the trunk if you're out traveling so that it can stay cooler through those windows. You all know that heat makes insulin less effective and it can really cause your pumps to malfunction. Everybody knows how to troubleshoot, right? In the summer, you're trying to figure out, is the insulin bad? Is the site bad? Oftentimes, the culprit is the heat. They actually make cooling cases, though, specifically for insulin that can help you manage your supply. Now, here is a fun fact. I didn't know this until recently, but there's actually a specific temperature where your insulin's in trouble. Any guesses? It is 93 degrees Fahrenheit. That temperature might seem kind of extreme, but after 2 hours, like I said, in the car, maybe you're outside playing sports, out at the beach, trying to relax, right? Your insulin could be in trouble. Make sure you're monitoring that. Make sure you keep it cool. Grab a cooler, throw some ice packs in there, put it up in towels. Tons of stuff you can do to make sure that's protected. Okay, tip number 4. We all do this, right? But especially in summer, make sure you're packing those snacks for any road trips, any outings, any sporting events. Stock up on your food. And if you can, get the good stuff, right? Get the fruit snacks, get the chips, all the stuff that you really want, but you got to save it for those lows. You guys know what I'm talking about. They can help prevent blood sugar lows and help keep you on your food schedule, no matter what your trip or your outing is throwing at you. So stock up now. And then here is tip number 5. You might not want to hear this, but it's important, okay? Exercise, it's always important, but in the summer, we might need to make some adjustments to our schedule, right? So plan your outdoor exercise if you're going for a run, even the walks, okay? We all love to go for our hot girl walks. Do that maybe in the morning or at night, the cooler parts of the day when the sun's not right on top of you. If you wear your stuff on your arm, you can't help it. The sun's going to hit you when you're not even paying attention, and it might cook the insulin right in your pods. So you can get outside, make sure you're getting your exercise, but just be smart about it. Pick the right time. Even sweating, right? That impacts things because too much moisture can try to damage that adhesive. It might come off. There's so many things you can get. You can see on my arm right here, I'm wearing a huge patch because I got hot and it was sweaty. My stuff's trying to come off me. So many things you can do to protect yourself this summer and make sure we all have an incredible summer. So those are my 5 tips for beating the heat. So excited to see you all here today at our virtual TypeOneNation Summit. Stay tuned for the next one. And you can find even more tips just like this at jdrf.org/beat-the-heat. More tips and travel checklists there. See you soon.
Those were great tips. Thank you so much, Madison. I got my water right here. I know I need all those tips when I take my hot girl walks in the summer. So thank you again, Madison, for those tips. Our next guest is Dr. Josh Veith, PhD. He is the Director of Research at JDRF, responsible for disease-modifying therapies, which are treatments that alter the course of type 1 diabetes, slowing down or halting its progression, preventing its development, or reversing it entirely. I like the sound of that. With recognized expertise in immunology, organizational development, and scientific communication, he received his BS in biology from Baldwin Wallace University and a PhD in infection, immunity, and transplant science at the University of Toledo College of Medicine. He completed his postdoctoral fellowship at the Memorial Sloan Kettering Cancer Center and the Child Health Institute at Rutgers University. Dr. Veith's research focused on rare T cell subsets and included the novel discovery of the development of the adipose resident natural killer T cells in the thymus. Following his postdoctoral studies, he served as the managing director of immune monitoring and advanced genomics at the Rutgers University Cancer Institute of New Jersey, tasked with developing the facility and establishing a robust research program for clinical trials. Joshua spends his free time focused on several causes, including serving as a president of the board of directors of the Morris Animal Refuge in Philadelphia, Pennsylvania. He currently lives in Brunswick, New Jersey. Please welcome Dr. Josh Veith.
Thank you, Jordan, for the long introduction. I appreciate that. It's a pleasure to be here tonight. Yes. And I'm so excited to join this group. I'm excited to be able to share some of the amazing work that's going on at JDRF. And I appreciate all of you joining us this evening to hear what's going on and to take part in these summits. They're so important for the outreach that we have to do in order to keep the research moving forward. If we talk about the theme of this series, which is research and advocacy, that really gets to the magic of what we do at JDRF. It's a pipeline. It's moving something from an idea to a therapy and getting it into the hands of patients. And we have a staff across the board that focuses on these. We have scientists that oversee the discovery research that tests ideas and determines whether or not an idea is able to lead to a therapy. We then have to run clinical trials. So we have translational development where we run the trials and we test whether or not this idea can become a drug, can become a therapy that could potentially change the course of disease. But that's not the end of it. That's the start of it. We also have to work with the FDA and the EMA, the European Medical Agency, for regulatory approval to make sure that we improve the prospects that once we develop a drug, once we develop a therapy, that it's going to get approved and to get into the hands of patients. And then finally, there are two major parts of this process are healthcare coverage. It doesn't matter if we develop therapies if people can't afford them. So we try to increase insurance coverage, affordability, and giving people a choice to choose the therapy or the device that's best for them. And finally, clinical adoption. In order for these drugs and therapies to get into the hands of people that need them, we have to make sure that our healthcare providers, our physicians know about them and know about their use for people at different stages of disease. And we also have to educate the community. And this is exactly what we're doing here tonight and why it's so great to have you all here is we want people to know about what's exciting, what's coming, and what to ask their doctors about at their next visit. And ultimately, all of this leads to better outcomes. So I promise this is the most in-depth science slide I'll go through tonight, but it's really important to understand the science behind the disease if we're going to understand the JDRF research strategy, which is why we do what we do. Type 1 diabetes is what we call an autoimmune disease. And that means it involves the immune system. And really the primary role of our immune system is to survey your body. And when it bumps into a cell or something, it decides, is this me? Is this not me? And if it says it's not you, how do we get rid of it? It's about protection. Unfortunately, when we talk about autoimmune diseases, this means that your body has incorrectly identified part of yourself as a threat. In the case of type 1 diabetes, your immune system, for whatever reason, the same way it would identify a virus or bacteria, has identified the insulin-producing cells in your pancreas as a threat. And it started to attack those as it would any other pathogen or something it identifies as non-self. So if we go through the stages of the disease at the bottom of the slide, there's pictures representing stage 1, 2, 3, and then established or stage 4 type 1 diabetes. And really we call stages 1 and 2 pre-symptomatic. And this simply means that you haven't lost enough of your insulin producing beta cells for you to need insulin injections. But the disease actually starts long before this. The recognition of those beta cells by your immune system happens long before stage 1. In fact, we also know that there's certain genes that we can test for that make somebody predetermined or predisposed to developing type 1 diabetes, or what we call at risk. So that's what makes the screening and monitoring portion of our research strategy so important. Then, as your immune system continues to deplete some of the beta cells, and the beta cells are the ones you see in these pictures that are sort of a tan color, you start to have autoantibodies. This means that immune reaction has initiated and has started attacking the beta cells. Eventually, you lose enough of those beta cells that you have changes in your HbA1c level, and you start to need insulin. You start to need to inject insulin, and that's what we call clinical diagnosis, or stage 3, and then ultimately establish type 1 diabetes, where you've lost the majority or all of your insulin-producing beta cells. So from a research standpoint, I talked about screening and monitoring being critical for the rest of the pipeline. We also have disease-modifying therapies. These are the therapies that try to reteach the immune system or rebalance it so it stops attacking beta cells. Teplizumab, Tzield, one of the first drug approved for type 1 diabetes for those at risk in stage 2, is a disease-modifying therapy. We also try to protect and expand someone's own beta cells at this stage to preserve the insulin-producing beta cells they still have. But finally, in established disease, there's 2 programs that work on this. One, we'll start with cell therapies. That means finding renewable sources of cells that we can transplant into patients to give them or to allow them to regain their insulin independence. And also improving lives, which is a huge portfolio focused on the devices everyone relies on, the CGMs, the insulin pumps, the adjunctive therapies, the therapies that deal with complications like heart disease and kidney disease. That's all part of improving lives. There's far too much here to talk about in 15 minutes. So what I'm going to do is I'm going to talk a little bit through what we call the cures side. This would be the screening and monitoring, the disease-modifying therapies and cell therapies, and some of the strategy behind those sections in particular, and some exciting advances that have happened recently. So let's start with our screening strategy. Ultimately, screening is about research. It's about building the evidence we need to show that there's feasibility and acceptability for screening and monitoring in the clinical setting, making the case and developing the technologies to expand screening initiatives. This also involves health policy, making sure there's affordable access to screening and to the cures therapies that follow, and also education and clinical implementation. So making sure we educate the T1D community about the screening that is available, that we upskill our healthcare professionals to make sure that they know that this is something they can recommend to patients, and then ultimately we contribute to clinical guidance and increase awareness to increase adoption. Now, one of the most exciting things that's occurred recently, or one of the most exciting projects currently going on in our screening portfolio, is a partnership we formed with RTI in North Carolina. And this is a close to $2 million investment. And the goal of this study is to screen childhood onset genetic conditions. So screening newborns for the genes that are associated with disease. And we've included genes associated with type 1 diabetes. So assessing the genetic risk of developing type 1 diabetes later in life. Now, this is what's called an implementation and feasibility study, meaning that learning about your risk for type 1 diabetes is optional, but we're very happy to see that most parents involved are choosing to receive this information. Importantly, and this is where the JDRF approach to screening is so important, that these newborn parents that receive this information and follow the study protocol then have access to educational information. So on what being at risk means if it's identified their child might be at risk, and also what to monitor for looking for disease onset and the symptoms of the occurrence or the beginning of type 1 diabetes. Our goal through this is to screen at least 2,000 to 5,000 newborns. And while greatly increasing the screening operation, it's also going to validate a genetic risk score to improve our ability to predict whether or not somebody is at risk of type 1 diabetes later in life. Now, the next section of the disease or of the cures portfolio is disease modifying therapies. And the strategy here is really twofold. I told you a little bit earlier that Type 1 diabetes is an autoimmune disease. It means the immune system is attacking the insulin producing beta cells. So, in disease modifying therapies, we have two goals. One, we want to identify immunotherapies. And these are therapies that aim to rebalance the immune system, to teach it to stop attacking beta cells or to get rid of the immune cells that are attacking beta cells. And then we also have beta cell therapies. And this is working at developing therapies that can preserve, increase, or create called functional beta mass. So, how do you preserve or increase the number of beta cells in someone's own body in the context of type 1 diabetes? Now, one of the most exciting advancements in disease modifying therapies recently is what I spoke about earlier, teplizumab or Tzield. Tzield was the first disease modifying therapy approved for type 1 diabetes, and it's currently available for those in stage 2 that have been identified as at risk, that have multiple autoantibodies, but have not yet been diagnosed with type 1. Now, that was approved a little over a year ago, but excitingly, just a couple months ago, in December, a study called PROTECT reported out. And PROTECT was testing whether teplizumab can also be used to preserve someone's beta cells and insulin production at the point of diagnosis. And excitingly, it does. There was incredible data. If we look at this graph and we assume that higher on the graph, your higher C-peptide level indicates you're producing more insulin, we can see that people that received teplizumab at diagnosis or recently diagnosed continued to make more insulin, to produce more insulin compared to those that met placebo. And what's amazing about this is teplizumab now joins 6 other disease-modifying therapies that have shown an ability to do this at diagnosis. This is changing the conversations we're having. We're not asking if it's possible. We now know it's possible, and we're working at moving these through the FDA process to make them available for people at diagnosis. The final portion of the Cures portfolio is cell replacement therapy. And our strategy here is twofold as well. One, we want to create a renewable source of insulin producing cells. In many cases, this means stem cell derived or lab created beta cells that can be transplanted and allow somebody to produce their own insulin in response to their needs. We also have to work at ways to deliver these and protect these so that when we transplant the new beta cells, that they aren't attacked by the immune system. And we want to do this in ways that doesn't involve lifelong immunosuppression. Now, there's been a number of studies that we're funding, and I won't go into all of them, where we're looking at trying to develop stem cell-derived beta cells. And Vertex is a company that has done clinical trials to show that it is feasible, and you can restore insulin independence, meaning that you can transplant beta cells from stem cells without, and the patients that receive these cells did not reduced or no longer needed to inject insulin. Another company we're working with is Cernova. And we're working with the Cernova cell pouch. And this is more about protecting the insulin producing cells that are transplanted. Now, Cernova has what's called a cell pouch, which allows you to place the islets within that pouch. And this pouch, almost like a tea bag, protects them from the immune cells attacking them. Now, in the initial cohort, the initial study, they implanted this cell pouch into 6 patients, and 5 of them have remained insulin independent, meaning that it's replaced their need to inject insulin, going from 6 months to more than 3 years. They've recently started a second cohort because, based upon the information they learned in the first study, they developed a pouch that can hold up to 56% more volume, which means they can transplant more islets that are protected. And enrollment of the 7 participants in this study is currently underway, and we're very excited to see the results. I wish I could go through all of the amazing and exciting things we're working on right now, but the take-home message is really it's been an incredible decade of JDRF advancement and breakthroughs in type 1 diabetes research. And if you think about how far we've come in the last 3 to 5 and certainly the last 10 years, we've come from an idea that insulin is enough and that only insulin is needed to treat the disease, to now having a strong improving lives portfolio where there are multiple devices on the market that people can choose from. We've established a strong proof of concept that we need adjunctive therapies, and we need therapies that can treat the complications of disease, and recently launching both pivotal kidney and heart trials to help with those complications. For screening, we've gone from not having T1D risk factors or not knowing about autoantibodies in screening to having not only these autoantibodies, these risk factors identified, and also the staging of disease, being able to determine whether somebody's in stage 1 or 2 or 3, being recognized by the regulators and the FDA. And this has been a huge push toward moving forward the research being done in the other areas, because once we can identify patients and once we can stage and recognize different stages of disease, we can continue to move forward disease modifying therapies and cell therapies that can treat people at that particular stage. For disease modifying therapies, we've gone from really just having preclinical or ideas about immune targets we can target or we can go after, to having, as I said, the first FDA approved therapy in stage 2 and 7 different therapies showing efficacy in new onset type 1 diabetes or stage 3. And that's just astounding. And finally, we went from having really no evidence that we can make beta cells in labs that are able to produce insulin to now having both stem cell derived beta cells and a diverse portfolio of protection strategies currently in clinical testing. This is a huge step forward. It's been an amazing few years of advancement. And I think what's most exciting is with these advancements and with the strategy we have that's based upon the biology of disease, and with the incredible scientific advancement, the ability for some things to happen in the lab and the clinic that we weren't able to do even a number of years ago, we're going to see more advancement in the next few years than we've seen in the last 10. The rate of discovery, the rate of moving these therapies forward is increasing. And all of you here tonight are an important part of that. We can't continue to do this without the effort of the entire community. And one of the questions we get asked is how to get involved, and basically how can we all continue to work together to advance this research and to build even more breakthroughs in T1D research. And really it all comes back to one place: go to JDRF.org. Because at JDRF.org, there's going to be a number of areas you can go to first of all, stay informed, to read our blogs about the latest research and advocacy issues, to sign up for the pipeline, which is our monthly research newsletter that's going to let you know about clinical trials and results, to follow our advocacy initiatives, whether it be calling your representative to ask for funding for the special diabetes program or for voting for affordable insulin. That's a huge part of what we need to do to move these forward. In your community, you can become a research information volunteer or a clinical trial education volunteer. Both of these are critical positions to getting the information out and letting people know in the community know about the research and the clinical trials that are occurring and that are available in the area. Attending events like this is huge, whether it's informational events where we're getting the word out or fundraisers. This is all critical to our ability to move this pipeline forward. And finally, screening and clinical trials. It's so imperative that we increase the amount of screening and screen more people and screen earlier to identify people earlier in disease when we're still able to intervene when they're still producing their own insulin, but also for availability for clinical trials so that they can take part in the trials that they may be eligible for. We can increase the number of clinical trials we're having without increasing the amount of screening. And ultimately, clinical trials are the key. So creating a culture of clinical trial participation in type 1 diabetes is absolutely necessary if we're going to continue to advance the field. And you can go to jdrf.org to learn about the clinical trials that are available, to tell the others in your community about them. And as we continue to add more trials to that site, hopefully there are trials that can help people at all stages and ages of disease. So with that, again, nights like tonight are so important to get the word out and to show that we're all working together to move this research forward. And I guess I'd just like to mainly thank you all for taking part in tonight and for giving me the opportunity to come and to share some of the exciting things going on.
Oh my goodness. First of all, I feel like I have gotten so much smarter just from listening to you in those past 15 minutes. And also, I mean, you're thanking us, but I just want to thank you. I kind of get emotional thinking about all of the time and energy and research that you and your team does to make my life as a T1D better, but also the future generations of T1D's lives better. So thank you for all that you do. But before we let you go, you're not going to get away from us that easy. We're going to get some questions from the audience to get to see what they are wanting. And you kind of touched on this question a little bit, but how can we support research? Is it mainly participating in clinical trials, donating, or something else? What kind of support do researchers need from us, the community?
Most certainly. First and foremost, continuing events like this so that we can raise the awareness and raise the funds to support more and more research moving forward is critical. And Mariana, thank you for your question. But beyond that, beyond the fundraising, beyond the awareness, it really comes down to awareness around screening, as I said, in clinical trials. We really have to get the word out about the ability for people to get screened and to push for broader screening. And we have to let people in our community know when clinical trials are available, because that's how we advance. That's how we develop the proof in order to have the data to take to the FDA to say that this drug should be made available for the community.
The proof. We need the receipts. I like that.
We need the receipts. You're right.
Okay, Linda is wondering about the status of the Vertex encapsulation device clinical trials. I think you mentioned that in your presentation as well.
Yes, thank you, Linda. So we are very excited by the fact that the first 6 patients in the first Vertex trial all received the stem cell-derived beta cells and showed reductions in their need for insulin, which means that we can create beta cells in the lab, and these cells are functional. Now, the next step is protecting those cells. So the second Vertex trial, which was just approved a couple of months ago, is working at putting those in, encapsulating them, basically, putting them in a device, a package that protects them. And they're currently recruiting for that study, and we're eagerly awaiting the first set of results.
That's so exciting. I love this. And Burns Wheels says kind of what I was just echoing. It's incredible how far things have come in the last 10 years. When you think about, everything that you listed out, what gets you the most excited, Doctor, about what has come from the past 10 years?
Oh, I think it's about choice. We're not talking about a cure. We're talking about cures, plural. And we're talking about an approach where not only do we have multiple devices on the market, where 10, 15 years ago we were talking about, can we develop an artificial pancreas, right? And now people can choose which device they use. And where we're going now with the advances in disease-modifying therapies and cell therapies and increasing screening is that there's going to be options on the market to be able to treat people's particular stage of disease or their particular disease. And we're going to speak to both rebalancing the immune system, and we're going to be able to provide combination therapies that can pair that with increasing beta cell production and the production of insulin. And all of the tools are there. All of the background is there. Now it's up to us to move the clinical trials forward and figure out how to create the combinations that lead to a cure that can allow us to both protect and increase the function of the beta cells.
We love options. We love having choices. Thank you so much, Dr. Beath, for all of your knowledge and for sharing this information. It is so, so appreciated.
Thank you. It's truly an honor to be here. And thank you, Jordan. We appreciate it.
All right. Well, I loved that. That was, again, I feel like I got smarter, and I love feeling like I got smarter. I hope you guys feel the same way. We're going to keep it rolling here. Our next guest is actor Austin Basis, born and raised in Brooklyn, New York. Austin always knew he wanted to be in the limelight, captivated by movies, theater, and television as a kid. He pursued a Master of Fine Arts from the Actors Studio Drama School in NYC. He became a lifetime member after he graduated. Austin has been featured in several primetime television series and is most known for starring roles in the CW's award-winning series Beauty and the Beast and Life Unexpected. He has also been featured in Curb Your Enthusiasm, How to Get Away with Murder, one of my favorite shows, Grey's Anatomy, the award-nominated series Casual, Little Fires Everywhere, Homeland, and HBO's Winning Time, based on My LA Lakers. He can now be seen on the 5th and final season of The Marvelous Miss Maisel. adding to his impressive resume, Austin co-authored a children's book titled Zoos on First and the comic book series The Kinetics. He also launched a podcast titled Actor Speak. Austin was diagnosed with T1D when he was 8 years old and has worked hard to manage the disease throughout his career. Living with T1D from an early age inspired him to become a strong advocate. As an ambassador for JDRF, he demonstrates an unwavering commitment to T1D education, advocacy, and fundraising for research to find a cure. Today, he joins us to share his personal story and T1D journey. Please welcome Austin.
Hi, everyone. Nice to be here. And I look forward to talking to you, Jordan.
Yay! I'm excited to talk to you too. Those pictures were incredible.
I did not know the graduation picture was going to be there, and that's really embarrassing. I'm like, how does someone have that?
Never embarrassing. And we will find it. We do research here. That's what we do. That's what we do.
Right.
Well, let's get started because I want to hear more about your story. I know you were diagnosed with T1D at a young age, but we kind of just saw that a little bit. But how have you seen the management and treatment of T1D evolve over the years? And what advancements are most significant to you in your story?
Well, I was diagnosed in 1985, which is, next year will be 40 years ago. So I don't look it, but, take off my hat. It adds about 10 years. The technology has been amazing. There weren't even glucometers when I was diagnosed, or at least they were metal and big. I used to have to test my blood sugar and, wait a minute and wipe off the blood and then test the color stick against, almost like a urinalysis test against the bottle. Slowly I got a glucometer and, more advanced glucometers that you wait less time. I used to have to wait like a minute, for the blood sugar level to be tested. So late 90s, I'd say, so I got it in the mid 80s. So 15 years into, almost 15 years, 12 years into having diabetes, I was transferred by my endocrinologist onto the pump. And I've been on the pump ever since. And then I would say about 10 years ago, I added the ACGM to my regimen so that now I have a closed loop system, pump, continuous glucose monitor that adjusts and calibrates sometimes on its own, without me worrying about it if my blood sugar is off. So these are the leaps and bounds in technology that we're talking about, and life-changing because my A1C is directly affected by that adjustment only, within the last year to get the closed loop system last summer. And it's already, my A1C is already down a unit. So, it's crazy.
We love that. The pump for a year now too, and life-changing is the only way to describe it, I feel like. And so I love technology, and I love that it is working with our bodies in this way. But transitioning for you from adolescence to adulthood is challenging on its own, but adding T1D in there adds to the complexity. So how did you personally navigate that transition, and what advice would you give to a T1D out there who is trying to navigate through that?
Well, I was when I was younger, I did sports. I was a kind of a nerd, good at school, but I, did after school stuff like sports, like baseball, basketball, and also theater. So all these things. And it was funny that one of the pictures was me juggling, because a lot of times as diabetics, you feel like you're juggling way more than any human being should have to juggle on their own. And so with that in mind, the transition from me being an athlete and having to manage diabetes without a CGM and without a pump, and having snacks with me all the time, being prepared and giving me kind of responsibility at a young age. And, my parents as well, they were pivotal in me having a normal childhood and being able to do theater and be on stage in musicals, dancing and singing for 2 hours and not have to worry about me going low. and having snacks backstage or off stage, right off stage. In sports, it was on the bench, knowing what my limits were, testing those limits and having my dad yell from the sidelines, "You low us," is kind of a nightmare ringing in my ear from my childhood. So after a while, that is in your own head, and it becomes kind of, and my mom was a health and phys ed teacher before she retired, and that was good. She knew the dynamics and what was required of the disease, and they're not medical professionals, but we had a good team around us of endocrinologists and nurses that got me to a place where that transition was really smooth. And to kind of transition from sports to theater and acting, where there's cut and, takes, on camera, film and TV, where you could just stop a take and get something to eat and then go back and do it again. That's much easier than a live sporting event that, there's a clock ticking down and, you can't really come out of the game if, your team wants to win or you want to be part of, the event. So, yeah.
Yeah. I mean, I played basketball starting at 5 years old. I went on to play in college, but this was all pre T1D. So I can't imagine. Now I'm playing in an old lady league and my husband is on the sideline with the Dexcom on his app saying, "Love, sub out."
Yeah.
So I feel that.
A guy met Max Domi, who's an NHL player with T1D, and he talked about like overdosing on sugar in his first NHL game, and like the puck being dropped and puking all this, and then he had to he didn't have the sugar in him, so throughout the game he had to constantly, he has a system designed where he had a special drink made, a high potency sugar drink that was, trainer, nutritionist, it was able to not have to fill up a belly full of, orange juice or apple juice to get your sugar up 15 units. But to be there on the sideline, kind of like Gatorade is for regular people with electrolytes, we need the sugar because Gatorade doesn't have that much sugar in it. And so, I liked hearing about the electrolytes from the tips before because I didn't know that. So now I know that that's a good thing to have that to prevent my blood from dropping in the heat of the summer. I'm in LA, so there's a lot of heat. But yeah, it's a little easier having apple juice right off camera that I could sip in between takes and manage my blood sugar than it is, running shifts for a minute and a half on an NHL, rink.
Very different. Live sports is tough.
Yeah.
But I know as an actor, you're balancing your career with the demands of T1D. It not only requires planning, but it also requires a lot of self-care. So what are some things that you do, maybe routines that you've developed to prioritize your health as you pursue acting?
I, for the acting thing, it's just always, testing more on days that I work, always having, a balanced diet, not overloading on carbs. It's not like I'm running a marathon, but because usually, if you overload on carbs, there's going to, there's usually a dip down, just like when you're low and you regulate, a lot of times it peaks up a little afterwards. That's how it kind of works. And just balancing and making sure that I'm not eating a lot of carbs on the days that I work, so that if I need them to get my sugar up to normal, that I can have them, and eating foods that don't necessarily, not like simple sugars, like, complex carbs, and fruit and vegetables and stuff. And so, and then in normal life, I feel like I've always preferred competitive sports for athletics and to keep in shape. But as 40 something year old guy, it's harder to play that and not risk injury. So what I've basically had to, do is shift from normal, competitive sports, athletics, to, daily or walks every other day at least. And because I'm in LA and the weather is usually good, not this past winter, but usually, to take hikes, it's nice to just get out. And especially, as an actor auditioning inside and at home, you don't really go out to auditions anymore because of how it shifted throughout the pandemic. So it's like getting out of the house, taking hikes, walking, and, kind of sticking with aerobic activity. And, my new challenge now is just to try to get a little more weight work in, just because, as I've read or heard some things about just that it helps metabolism more. And, it's something that I don't love doing, because it's kind of just sitting there and, lifting stuff. And, I like the competition. I like, even on an elliptical, competing with myself. How many miles could I go? How fast could I go? How many calories could I burn in 45 minutes or an hour? But, the body changes, just like your relationship with the diabetes changes, and your career changes. So you kind of, again, going back to the juggling thing, it's constantly juggling and adjusting and adapting. And if you're able to adapt to new environments and new circumstances, I feel like that's the best way, just to have an open mind to flow and adjust to new things in your life, whether it's schedule, exercise, foods, job, that type of thing. Yeah.
I always wondered too, because for me, I do like a mix of live television, hosting, and even just comparing it to when I play basketball.
Yeah.
Like there's like an adrenaline rush right before, they say action or they say go. And my numbers spike with that, as if I just had this huge meal. Does that happen to you too sometimes, where you have to kind of regulate it while you're on set in that way?
Yeah, to a degree. It's like, you think of it like the blood sugar always goes off at the most inopportune times. That's pretty much it. No matter how much you prepare. I've never necessarily had I've kind of always, even though I get stressed, I haven't, I think stress causes the blood sugar to spike. And I never look at it as a stress. It's more anxious or like energetic, right? And I will, depending on the scene, do a regimen of physical stretches, activities. Usually with every scene, I'm definitely stretching to make sure my body's relaxed, and it's a acting school kind of thing. So, just like athletes have, to use their body, it's a full body sport. If an actor is not connected to their body and tense or overwhelmed, or the blood sugar is off, because that affects your body. Like, if it's low, you sweat, you get disoriented, you may forget your lines. If it's too high, you may cramp up and dry mouth, and, just a more of a flush, feverish thing. So it's like, to balance that stuff out, it's always like kind of just being in touch with my body and being as relaxed as possible, whether it's in my shoulders, my hips, my hands, like making sure everything's kind of relaxed. It's like the actor studio kind of, every acting technique has relaxation as a foundation, but it's especially important for the actor studio and like the way I work as an actor.
I'm going to try that. That's a great tip to stretch and just relax the body more. I think that's a great tip. I'm going to try that.
Yeah.
So when you think about, your incredible career, I listed all of the things that you've done and you're in. What are some of your most fulfilling moments?
It's always hard, because it's like you just want you want the next job, right? So that's where I'm at now. I'm like, I'm looking forward to the next projects and what's next. But looking back, I feel like, obviously, like my most recent project, being on the final season of The Marvelous Mrs. Maisel, was important and felt vindicating or kind of validating for several reasons. One, because I got to go back and shoot in my hometown of Brooklyn, New York, even though some of the stuff takes place in the city. It's New York, it's not, we're not going anywhere else. But we shot in Brooklyn. I lived in Brooklyn for like 8 months. Was able to see, my friends who are still in Brooklyn. Not all of them are still there. Some are in Jersey, some are in California, some are in Florida, Connecticut, Pennsylvania. Not everyone stays, home. I didn't, so, but it was great. It was a great year. Also being on a show that is, Emmy nominated, and having the track record and the people that you only hope to work with when you come out of acting school and you start as an actor, people that have won all types of awards, and not just the actors, but writers, directors, cinematographers, like some of the best behind the scenes people that are out there, working in, at least in television, but definitely even in film too. And so it was kind of thrilling, kind of felt like I was back on stage. It was a lot of, as an actor, one take shots. So one scene that was like 4 pages would be one shot. So everyone had to be perfect in it, almost like a performance in front of an audience. So there wasn't room to like mess up, and like you can cut away and use take 1 for this, take 2 for that. It had to be all in one take, and it had to be perfect. So sometimes we do 15 to 20 takes of one chunk of scene, and depending, it had to do not only with the acting, but the camera work, everything. And so that was thrilling to kind of feel like I was back in theater and doing a New York kind of character, like I grew up doing Neil Simon stuff, and I've talked about it before, but it's like, it's those were one of my first plays, Brighton Beach Memoirs. I saw the movie. I saw, I didn't see Biloxi Blues on Broadway, but I saw it in the movies, and I did Brighton Beach Memoirs, not only, watching it, but I was one of the characters in a college production, and, a couple other plays that Neil Simon had written. And here I was playing a character that was a writer, on television, that, had just worked in a group with the best comedy writer, some of the best comedy writers of all time, and mentioning even Neil Simon in my dialogue.
That's so cool. That's a full circle moment.
Yeah, definitely full circle, because my first play in college was Brighton Beach Memoirs, so it was so like cool. Definitely. And then just to be working, and my acting. Your acting is always improved by the level of talent and people you're around you, whether it's the writing, it starts with the writing. But then to work with other actors that are bringing out a performance, and to be there in a place where like you're just really trusting your instincts, doing your own work, and then everyone else makes it that much better. I think that I think is a dream type job, and you only hope to have a few more of those in your career. And anyone, whether it's an award show, or a show that award-worthy show, or a show that just has that atmosphere where everyone's putting in 100%, and the product is that much better because everyone is that talented.
You're living the dream.
Yeah.
I love that.
Yeah.
And as we wrap, I guess, just what is your message or advice to others in the T1D community, especially those who may be newly diagnosed, who are watching, as we all cope with the highs and the lows of T1D?
Yeah. Well, the reason I started advocating and being an ambassador with JDRF is because when I went to walks and stuff, when I first had diabetes in the 80s and 90s, there weren't really necessarily any actors other than Mary Tyler Moore I could look to. And, I put her on the same level as my grandmother, who also had diabetes. And so it was like, while I saw that there was, a possibility of me being an actor, I wanted to kind of fill the void that was there when I was younger. And so to me, it's just about providing an example of success and persistence, whether it has to do with your health or your career, your chosen career, whether it's athletics, music, you know, you could be a researcher, you know, you could help cure diabetes or find one of the cures, the many cures that are being developed now, you know, just to provide some inspiration and to know that whatever you choose to do with your life, you know, and for me, it was acting, that that diabetes hasn't gotten in the way of that. In fact, it's actually helped it, because it was, you know, something to overcome and something that I had to balance with a normal life of a young actor or a young artist coming up, and all that responsibility that I learned at a young age of taking, you know, snacks with me and checking my blood sugar and, you know, simple things like that. It's an extra responsibility that you bring into your adult life, that adults have tons more responsibilities, but learning those lessons early on helped me as an actor have at least a foundation of, you know, responsibility and self regimen that allowed me to succeed and you know, do my work and get everything that I need to get done in time for whether it's auditions, performances, and the like, and succeed as an actor without letting it get in my way, you know. You know, there have been close calls, but it's like when I enter a set, everyone, you know, like the important people know. I mean, I'm very public with it, but on a set, I don't need to tell everyone. I just tell the important people. And there's always apple juice or something close by that, as like, it's not usually going to happen. I'm in control, but just in case, you know, just in case we get going and we have to get this shot done before the sun goes down, and, you know, I could feel myself, you know, fading or waning, that I could just chug that apple juice. And that's developed over time, because certain things that you use, like Skittles or orange juice, create phlegm or create a situation where you can't talk, or you know, it affects you, as you know. And so apple juice has been the choice for me, but it could be something else for someone else.
That's great advice. Great advice. Thank you for sharing your story with us, Austin. Do you want to plug anything, or where can people find you on social media?
Well, you can find me at Austin Basis everywhere. Austin Basis, at Austin Basis on Instagram, at Austin Basis on, I guess, X, Twitter, whatever, you know, Threads, same thing. And then I'm on Facebook as well. I think it's Austin.basis, or /Austin.basis is my official website. And then like, I'm hoping to do a film about diabetes in the next year, and about my early hypoglycemic seizure. That'll be like a diabetic horror film. So I'm really excited about that, and continuing to write the comic books. That I have one right here. So it's it was called Diabetes. They're part of Kinetics, but we're working on a graphic novel, and hopefully it'll be available for kids to read at a certain point in the, you know, coming months, years, whatever.
Awesome. That's so exciting. Well, I'll make sure to follow along your journey. Thanks so much for sharing your story with us, Austin. It was awesome to meet you.
Thanks for having me, Jordan.
Thank you. Okay, now it is time for us to hear a quick message from Grace on the JDRF social media team about how we can hear from all of you and your amazing stories.
Hi, I'm Grace, and I'm the social media manager at JDRF. Everyone who lives with T1D knows that no 2 days look exactly the same, and that everyone experiences life with it differently. Everyone's T1D story is important and can help other people in the community feel seen, supported, and validated. That's why we want to hear from you. If you're interested in sharing your story and being featured on our social media channels, send an email to social@jdrf.org. We can't wait to hear from you.
Thank you so much, Grace. I can't wait to hear your stories too. The power of stories is what makes me smile about my job. So I can't wait to hear all of your stories. And a special thanks to our guests for sharing their stories with us tonight. I'd also want to say a special thank you to our sponsors, Abbott, Dexcom, Embecta, Ford, Insulet, Lilly, Marshalls, Medtronic, Novo Nordisk, Sanofi, Tandem, Vertex, and Xeris. You can learn more about the national partners who make the Type 1 Nation Virtual Summit possible and the latest in technology and T1D management at jdrf.org/TON Summit. Thanks for all of you for joining us this evening. If you haven't already done so, please visit jdrf.org/TON Summit and register for the series because you don't want to miss our next session of 2024. May 22nd, mark your calendars. We will be focusing on T1D mental health and overall wellness. So important in the T1D space. So stay tuned for more information on that soon. Thank you all for hanging out with me. Make sure to come back again soon. Good night.